Hello, and welcome to the Natural State Podcast. I'm your host, Dr. Anthony Gustin. It is my belief that the natural state of any living organism is health, and that our artificial habitat has forced us into having artificial health problems. This show is my attempt to dive deep and learn about using nutrition, sleep, movement, relationships, and more to help you reclaim your natural state of health in a modern world and show you how to thrive in an environment that's stacked against you. If you enjoyed today's show, you can find out more details and information at dranthonygustin.com. Today, joining me on the podcast is Dr. Mark Hyman, who I'm sure all of you know, who is a very popular physician, heads up the Cleveland Clinic, and has written a bunch of books. Lately, the one he has written is called Food Fix, which I think talked about on a lot of different podcasts, as well as my newsletter. I think about 15 times I've mentioned people to grab it and pick it up and read it to figure out what is going on with our food system, why people are sick, what we can do about it. This has by far been one of my favorite books that I've read this year, and I'm super excited to have Mark on the show today. We talk about a lot of different stuff, but go into the weeds around a lot of the main issues that I see around healthcare, our food system, the rut we're in, and how to get out of them. Mark's a super knowledgeable guy. He's been in the game for a very long time, can see these problems with a lot of clarity, which is very, very rare. So I loved this conversation with Doc, and I hope you guys enjoy it as much as I did. This episode of the Natural State Podcast is brought to you by Four Sigmatic. Four Sigmatic is my favorite purveyor of all things mushrooms and adaptogens. Not sure why these things are important? Well, you can start with my episode I did with Four Sigmatic founder Tara on this subject, but just understand that mushrooms are not part of either animal or plant kingdom. They have unique health properties that are very, very well researched. Everything between boosting mental clarity all the way to naturally supporting the immune system, which I'm sure is something that everybody cares about these days. Also, Four Sigmatic products have been stocked in our kitchen at the Perfect Keto offices for years now and are probably the second most consumed product next to our own. Their most popular product of coffee mixed with chaga, cordyceps, lion's mane mushrooms, etc. Everything to basically take the jitter away from coffee and add a lot of brain boosting elements is the fan favorite at the office and keeps everyone powered through long days without crashing, like they probably would if they had an IV drip of cold brew like most other startups do. Alas, I have been off of caffeine for the last 6 months or so. I've been trying to give my body a rest and recover and get my nervous system back to a point where it's not always thinking it's getting chased by a lion. So what I've been doing is I've been using their adaptogen powder, which has 10 different mushrooms, roots, leaves, berries, and superfoods, with their mushroom blend that has another 10 different types of mushrooms every day for the last 6 months or so. And I've actually personally seen a huge improvement in my HRV, stress levels, recovery, etc. If I'm facing down a really big work day, I actually added an extra packet of both their lion's mane and cordyceps and mix all of that together with a scoop of exogenous ketones, and it lights my brain up like nothing else can. I've asked the team at Four Sigmatic to hook you guys up, and so they're giving all listeners of the Natural State Podcast 15% off your Four Sigmatic order. Just go to foursigmatic.com/AG15 or enter code AG15, that's AG15 at checkout. That is FOURSIGMATIC.com/AG15 to receive 15% off your order. This show is also brought to you by Alitura Naturals. When I considered sponsors for this show, I reached out to Andy, who is the founder of Alitura, and pretty much begged him to support the show just because they are the only products that I trust to put on my skin. So much garbage is in skincare products that it blows my mind. I cannot find any other products. I do not put anything else on my body other than Alitura. It's actually a lie. I use White Oak Pasture's beef tallow soap in the shower, but other than that, everything sort of pre-post around that is Alitura. And if you don't know why, your skin is the largest organ in your body. It absorbs everything you put on it. And men are less known for using sort of skincare products, but women average over 250 chemicals that are in their bloodstream from their skincare products by the time they walk out the door in the morning. That is ridiculous. I personally use the moisturizer the clay mask in my sauna, and the pearl cleanser. My fiance uses way more. She has a little bit more of a skincare routine than I. And the products themselves are made with the highest end ingredients that you would ever find in skincare products. This stuff's incredible. Andy himself is a testament how these products work. He's been on the podcast before to tell his story, but it was amazing. He was in a horrific accident. His face got all mangled up, and he basically made this formula to heal his scars, and he is now a male model. That is not a joke. He has incredible skin and is obsessed with the quality of his ingredients and the sourcing of them. He was just in Hawaii recently sourcing one ingredient of the many that are in one of his products. This guy goes, visits every single farm and product, and it is incredible. The quality you get here is by far the best in the industry. And so I begged him to sponsor the show and also begged him to give you guys a little bit of a hookup. So if you use code AG20, you'll get 20% off in free shipping over at alitura.com. That's AG20 at ALITURA to get 20% off your order at alitura.com. Doc, thanks for joining the show today.
I'm happy to be here. How are y'all doing there?
Doing great. I mean, after I read your recent book, Food Fix, I was so pissed off about everything you wrote in there in a good way that I had to get you on to sort of chat about some of the issues in there. So thanks for making the time.
Yeah, well, I wrote Food Fix really to address the problems in our food system and the solutions. And it's called Food Fix, not Food Apocalypse, because I wanted to provide a roadmap for not just being in despair and angry about these issues, which we should be around the food system, but how to actually fix it. And the reason it sort of came to my real attention was because after decades of sitting in my office, seeing patient after patient with chronic illness that was caused by food, I began to think, well, if what they're eating is making them sick, then what's the reason they're eating what they're eating? And then I kind of thought, it's the food system, And then I'm like, well, what's causing the food system to be the way it is to produce the poor quality food we have? And I'm like, well, it's our food policies. And I'm like, well, what's causing our food policies? Well, it's the food lobby that drives policy. Just for one example, there was one bill that was the GMO labeling law in 2015. The food industry spent on one bill lobbying $192 million. There's no nonprofit on the planet that can spend $192 million on fighting one bill, but the food industry can do that because they're the largest industry on the planet, about $15 trillion a year, which is an enormous amount. And they actually are driving policies that subvert public health and put profits over people. And this has led to the production of the worst quality diet on the planet, which we are exporting to every country. And we're seeing increasing rates of disease and obesity across the globe. But in America, we're obviously among the worst, with 60% of us having a chronic disease. 4 in 10 of us have more than one. 75% are overweight, 42% are obese. And even more scary is the fact that even thin people are metabolically unhealthy. So when you add it all up, it's 88% of our population that is metabolically unhealthy, putting them at increased risk for heart disease, cancer, stroke, diabetes, Alzheimer's, depression, and more. And of course, COVID.
Yeah, so, I mean, which you saw that recently. And I think people were pretty shocked around the amount of COVID cases that didn't have comorbidities. And it was pretty staggering.
Yeah, absolutely. So we're really seeing that these are all diseases of inflammation. We eat a very inflammatory diet, and we are now all pre-inflamed, which is why COVID hits those who are overweight or sick harder than anybody else. So I think there's an opportunity for us to sort of recognize that we have a serious global issue around our food system that's causing us to grow food that's nutrient depleted, produce food that is disease causing, and that the economies of the world, and particularly the United States, are burdened by this. I mean, 60% of the population is chronically ill. That's 80% of our healthcare costs in Medicare. Right. And it's only getting worse. So unless we change the food we produce, how we grow the food, and how we process and produce the food and what we eat, we're not going to get out of this, and it's only getting worse. And I began to sort of look at not only the health issues, but the intersection with other issues. For example, the economy. 1/3 of our Medicare budget is for diabetes, probably 80% is for chronic illness. And, if Medicare were a company, it would be the largest company in the world with a $1.3 trillion a year budget. And within a few short years, we're going to be running out of the Medicare trust fund money. We're going to be increasing our, portion of our tax revenue that is going for healthcare. So by 2042, it's projected that 100% of our federal tax revenue will be for healthcare. So this is an unsustainable issue economically. And of course, it's driving climate change. I was shocked to learn that food industry as a whole, end to end, from soil degradation to the food waste to factory farming of animals, transport, refrigeration, all these issues are the number one cause of climate change together. And that the answer is often in not just in reducing emissions from carbon, fossil fuels, but actually sequestering carbon through building up of soil and natural ecosystems. And so I began even to draw the circle wider and look at social justice issues and racial disparities and health inequities and educational challenges that kids have and national security. And it turns out all these are all connected by food in one way or another, some more than others. And I think this is really a very empowering idea, because if it's true, then if we fix our food, we can fix so many of these downstream problems.
Yeah. And you looked into this and did a really good job in the book, sort of talking about all these tendrils and how they go out in all these different places when, I think people like you, functional medicine providers, as well as even engineers, people who are just sort of conditioned to look for root cause problems. Once you start looking into nutrition and understanding that the impact in health, then you just keep looking and keep digging and realizing how pervasive these issues are. And there's so much to unpack about what you were just talking about for all the different areas where we can go here. But in general, I think that there's just a lot of ones that I still have tons of questions around, surrounding especially Medicare, like you were talking about. We may run out of funds, yet you have a lot of people who make the stances because it sounds good on a political campaign, but Medicare for all, here's a solution, when 80% plus of Americans have, are overweight or obese. And I think it's 3/4 of people are on prescription medications, and we have no introduction to getting these people off of these things and reversing them. So instead of having a healthcare system, we have more of a sick maintenance system. And I'm just curious, and sort of if you think that there's any hope around getting this switched around and focusing some of the budget around more preventative measures instead of just saying, okay, everybody gets free healthcare now. That's one of my biggest fears, is that we do that and then we just go bankrupt immediately.
Right. I think that's a fair consideration. We we have the ability to provide healthcare for all. But if we don't address why people are sick in the first place, we can increase access and provide coverage, which should be a basic human right, but it will be catastrophic in terms of the results, in terms of our economy and the burden on the healthcare system. So the real question is, how do we prevent people from needing a doctor in the first place, or from having to be admitted to the hospital and driving up these healthcare costs? And it really is about going upstream. And that's really why I think this is such a promising message. And if we can, for example, look at models like Geisinger did, where they looked at food insecure diabetics who were costing an average of $248,000 per patient, and simply providing them with $2,400 of food a year and providing them with the support and education about how to change their lifestyle and diet, they were able to reduce costs per patient by $192,000, or an 80% cost reduction. And they did this, at a very low cost of intervention, and it should be the standard of care. The diet works. It works better than any medication or pills and injections, and it's something that's easily scalable, and yet Medicare doesn't pay for it, Medicaid doesn't pay for it, insurance doesn't pay for it, even though it's more effective than anything else. So this is the dilemma we're in. We're not actually paying for what works. We're paying for what has been pushed through by Medicaid and Medicare for traditional medicine, which is medications and surgery.
Yeah, and I think companies like Verta Health have done a good job at starting to exemplify what we can do when looking at food first, and sort of hybridizing some coaching, health coaching online, and taking the onus away from 100%. Having it have to be on, the average doctor patient is something around 12 minutes. Like, people aren't going to get the education they need around food system, food choices, what they should be eating. But their rates of how they're getting people reversed off diabetes and medication are staggering as well. I think the more we have some of these examples, I think that the more we're going to incentivize other people to create other companies to show that this is a sustainable thing long term.
Absolutely. I mean, these models worked. I mean, we see them work. We know how powerful that. We've done them at Cleveland Clinic in our research programs, and we really understand how to actually transform our health through shared medical appointments, group visits, lifestyle change, behavior change, science. And it's not that hard. It's just there's lack of political will. There's a lack of buy-in from the healthcare system. It's really driven by the way reimbursement's set up. So we don't really have an evidence-based healthcare system. We have a reimbursement-based healthcare system.
Right. And also, we were talking about COVID a little bit earlier, and I was just doing some math the other day, and 938,000 deaths so far this year, which is a very, very large number. And I think we could have done a lot to prevent some of those. However, there's a quote in your book, I think you mentioned that 11 million people die per year from bad diet, which pushes at roughly 8 million per year. And some of the other stats that I've looked up, 1.2 million deaths so far this year from HIV/AIDS, 3.5 million from smoking, 1.8 million from drinking, 1.2 million from diabetes, 6.7 million deaths from cancer, 13 plus million deaths from heart disease. If COVID was at 13 million deaths so far this year, people will be doing everything we possibly could to figure out that root cause and squash it. And we have these numbers, not just this year in 2020, but every single year. And it's like we've gotten numb to them. And I don't know what your thought is on this, and if we can ever sort of maybe use this as a springboard to say, okay, I mean, because what I understand is that we're trying to limit deaths from COVID, and that's why we're taking some of these lockdown measures, masks, looking for vaccines, et cetera. If we want to limit deaths and suffering, how are we not looking just at the statistical pool and saying, okay, where are the largest amounts of death, and how can we dig into that and prevent those as well, and put $3 trillion plus into solving these problems?
Yeah, imagine if we put in $3 trillion to solving diet-related disease. It would be staggering.
Yeah, how much food could we just provide for people, let alone if we did it in a regenerative way to restore ecosystems locally and fix the planet while we're feeding people?
Yeah, it's so true. I mean, we have such potential to really transform everything, but if we don't take it seriously, we're not going to be able to make it happen. And I think that's a beautiful frame that you just put together, which is, we have diseases which we know are killing millions and millions of people every year. I think 11 million is an underestimate, and that we actually can solve that. We have the solution. It's not like we need a drug or new vaccine or new strategy. We actually have the science to solve this problem. It's just the effort isn't there.
Right. And I think that there's so much of it as well that you point out a lot. It was, I think, the most infuriating part of the book for me is just I knew some of it, but I didn't know some of the details that you had addressed. But the corporate meddling into our public health system is just incredible. And whether that's people who used to serve on Coke or Pepsi or General Mills that then get appointed to government positions and then go back and forth, or the lobbying and the money spent. I mean, is this again something that you think has any end in sight, or is this just sort of the way it is and we have to work bottoms up?
Well, I think there's going to be a pushback for sure, but I think there's increasing possibility for change that is there. And I think there's an increasing political will, and we're seeing bipartisan efforts around regenerative agriculture, around factory farming, around soil conservation. So there's definitely a lot going on that I see as a positive effort, but it's going to be a slog, and there's change and resistance to change that has to happen before we can actually make progress.
Yeah, and I think that just another one of the things that are just super frustrating is just how much that funding goes towards influencing so much of the education we have in this country. And so you have these big food lobbies who outspend the NIH 14-15 to 1 and just flood the market with phony research that just confuses people. And then that goes into medical school textbooks, dietitian training, continuing education, dietary guidelines, et cetera. And this is where I sort of scratch my head. I mean, I went to Houston to give my opinion in front of the USDA regarding the dietary guidelines for this year. And I was one of 75 people, and to see basically 95+% of the rest of the people there being paid for from food lobbies. And to see it that intimately, where I had always just heard of it, but to see it and see these people seriously stand up and say that, there's a place for sugary beverages, Coca-Cola, things like that are actually good as a part of a healthy diet. It was just mind blowing. And how outnumbered the thoughts that I'm just saying, hey, real food is what you need to be focusing on, we're just squashed.
Completely. And I think that's unfortunate, but we have to just keep at it. I mean, you look at big movements that happened over time, right? Social movements around abolition or women's suffrage or civil rights or gay rights, or, these are all things that took time, that took effort, that, really needed a lot of social activism to make happen. But eventually things come around, and I think it's going to take a minute, but I think we'll get there.
Yeah. And I think that one of the things that you pointed out earlier as well around social justice, I mean, we've had a huge conversation about that this year, obviously. And I think that a lot of people underestimate the role of the food system having sort of a systemic oppression. And I love your, just quick, I mean, you wrote, I think, a couple of chapters on this, but a quick just synopsis of how you think that's the case.
Yeah, well, I mean, you just look at COVID. I mean, it's ravaging the African-American, Hispanic, and Native American communities because they're more susceptible to the infection because they're so unhealthy. In large part has to do with the diet and how they're targeted and actually focused on by the food industry, and have far more directed advertising, and their communities are far more infiltrated with these foods than other communities. And there's a lot of health disparities that are resulting from the structural racism within our food system. That's just one aspect of it. And then, of course, there's the food and farm worker issues. There's 20 million people who work in that industry. It's the largest employer in America is the food industry. And they're often marginalized. They barely make enough to scrape by, and often at poverty wages. There are often no protections from the fair labor laws for these workers because they've been carved out in the 30s and has never been fixed because the Dixiecrat Democrats from the South didn't want the African Americans getting included in the Fair Labor Standards Law because they didn't want to pay them. So they sort of carved out food and farm workers, which were mostly African American at the time. So it's a whole legacy of racial injustice and disenfranchisement from their own ability for self-determination and food sovereignty. So I think this is a really tragic thing. And I do think there's a level of food oppression and food racism that's embedded within our food system that is really poorly recognized. And it's often internalized by these populations, and they don't realize how much they're really struggling with these issues.
Yeah. I mean, it comes down as well to just being, I think that like almost a hierarchy of needs when you have so many other problems going on in your life and you're so disadvantaged, yet also in poverty. How, like when you go to a grocery store, we also have the SNAP program, the food stamp program that is stacked against people who use it. And they have no other choice. They don't have a lot of money. They have to buy stuff that is calorically dense to survive off of. And this is just always inversely correlated with the most nutritious food as well.
Absolutely. I mean, we just have the worst system, and I think it's unfortunate because the solutions aren't complex. I mean, we need to start from the farm and improve the quality of the soil and the ecosystems on a farm that then determine the nutritional density and quality of the food. And we need to figure out distribution models and production models that actually scale that up. And it actually creates a win for farmers. It reduces climate change dramatically. It increases biodiversity and increases water resources. So there's so many benefits starting at the farm. And then, of course, we need to work on those policies that are driving the problems. Why should, for example, the 46 million people on food stamps mostly be buying junk food and soda, and that's causing worse health outcomes and increased costs in Medicaid and Medicare. So you can create a coordinated food strategy at a federal level and state levels that actually understand these linkages and design policies to fix them. Whether it's infusing nutrition guidelines into SNAP, just like we have in Women, Infants, and Children, or WIC, just like we have in our school lunch guidelines, our dietary guidelines. So why, if we go to the trouble of creating dietary guidelines, do we not actually support the poor to actually and help them follow those guidelines by providing more nutritious food options through SNAP? So I think that there's there's really some simple changes that need to happen, but they can be really profound.
Right. And I mean, one thing I'm curious about too, I mean, I think that I don't want to make this a political conversation at all, but there's a video of Kamala Harris recently saying that she wants to, somebody asked her if they would tax meat if she was in office. She said yes. You have other people on the other side of the spectrum saying that they want to tax soda. I think either way, people go up into an uproar regarding taxation of food. And I think that there's just not a consensus among people who make this decision of what is real food. Like, we just don't have a definition of this. Mine is just that stuff that spoils, stuff that you can leave outside and then 2 weeks later you can't eat again. And this is where
I think food that rots, you mean?
Yeah, exactly. Ideally before it's rotting. But yeah, I mean, this is one of those things where who's going to be making the decision? What corporate lobbies are going to be able to influence people to make that decision? And, are we going to have a world where we can tax soda? And I mean, you pointed out in the book that it's very effective to do so. It really disincentivizes people.
It is effective. It's effective, but more effective is limiting marketing. I think, in Chile, they showed that limiting the targeted marketing at children and putting warning labels on the front of boxes and removing cartoon characters and eliminating advertising between 6 a.m. and 10 p.m. and on social media and in schools had tremendous impact. It was fourfold the reduction in eating junk food and improvements in health outcomes compared to taxing soda, which also has an impact. So it's fourfold bigger than an impact that's already great. And I think this is, there's not one policy that's going to fix this. This is going to have to be a coordinated set of strategies across the whole food chain in order to actually fix it. But there are a lot of models around the world where they've done this, in Chile and other places, in Mexico. In Mexico, just prohibited the sale of junk food and soda to kids, which I think is, I think is a drastic measure. But when you look at what's going on in that population, 1 in 10 Americans have type 2 diabetes. 1 in 10 Mexican children have type 2 diabetes, which is what we used to call adult onset diabetes. So we're seeing a tremendous amount of disease within this population that's terrifying. And they're having to take drastic measures to fix it. And we're going to be in that boat soon. I think we really should get ahead of it. And unfortunately, there's a lot of forces that push against that.
Yeah. And I think that a lot of countries now, especially, are actually looking at the data and doing a good job of saying, okay, this pandemic made a lot of people sick. We have data around the people who were unhealthy were more sick, and trying to make some changes to get their population healthier. Like Mexico, for example, just did that in response to COVID. But then we have the UK, for example, who came out and said, okay, we're going to make some changes as well, make public health a point of view. And then right after that said, saturated fat is bad. You shouldn't be eating this. And so I'm just a little concerned that we're going to jump to making some of these changes that we saw 50 years ago after Ansel Keys blew through that. Okay, we're just going to do it this way, and then I guess we'll figure out in 60 years if this worked or not.
No, it's frustrating, and I think there is general consensus on the science. I mean, I think there really is. When you look at coherent reviews of the science and the research, I jokingly created something called the Pagan Diet, which tries to move beyond the diet wars and the polarization of diet philosophies, and so to understand that we're all talking about the same thing. Whether you're low fat, low carb, high fat, low fat, whether you're keto, paleo, vegan, raw food. I mean, the similarities are far more with each other than there are with the traditional American diet. All agree that we should be eating whole foods. All agree we shouldn't be eating processed food. All agree we shouldn't be pounding our bodies with tons of sugar and starch. Most agree we should be eating good quality fats. I mean, the main debate here really is this sort of vegan meat debate. And I think, the meat story is a very complex one. I've written a lot about it. I've written about it in Food, What the Heck Should I Eat? I've just written a new book called The Pagan Diet, which I actually provocatively titled the chapter Meat as Medicine, which sort of goes through some of the studies that we are looking at. What is the meat we're eating? And if you eat feedlot meat, it's bad for you, bad for the animals, bad for the planet, should be banned, no question about it. That doesn't immediately mean that all meat is bad or that all studies show that meat is bad. In fact, studies of wild kangaroo meat compared to a feedlot beef showed that the kangaroo meat reduced inflammation, improved health markers, whereas the feedlot meat did the opposite. So it's not meat; it's what meat? Is it a wild bison that's been roaming on grasslands that it has for thousands of years and eating hundreds of wild plants that increase the phytochemical compounds in the meat and increases the omega-3 fats and reduces the inflammatory factors and actually provides a great source of nutrient-dense protein that's bioavailable and increases muscle synthesis compared to plant proteins. I mean, how does that compare? So I think we really have to look overall. There really is no consensus in the vegan community that in any way that meat is good, and I think that's unfortunate. You can be vegan, and it can be a moral choice or environmental choice, but even from an environmental point of view, what shocked me to find out as I was writing the book was that actually the only way to reverse climate change and to draw down carbon in a scalable way is to use regenerative agriculture. And one of the key tenets of regenerative agriculture, and I go through all of them in the book, is that animals have to be integrated into the food cycle of an ecosystem of a farm in order to build soil, to fertilize, and to actually create the carbon sequestration that's needed in order to reverse climate change. So, and the Impossible Burger, for example, is a plant-based burger, but it's GMO soy, and you actually would have to eat one regeneratively raised burger to offset the carbon emissions of a feedlot. Of a GMO soy burger. So it's not so simple as feedlot versus vegan. It's more, what is the impact of regenerative agriculture? And there's a lot of new science that's coming and a lot of debate about it. But I do think that the evidence is pretty compelling that it's the only way to build soil, to reverse climate change, to produce nutrient-dense food.
Yeah, I mean, you make just so many good points around, I think, the arguments around people who are at the edges of nutrition trying to push them forward, whether it be vegan or carnivore or anywhere in between. I see some podcasts where people are just going after each other saying, no, vegan's the way to go. And people go, no, carnivore. But really, they're just trying to say, or low carb or high carb. And everyone agrees upon real food. And we have such a large amount of people eating processed food. And so I don't know why we can't rally around just, I don't care what you eat in the spectrum of real food, just eat real food. And then, like you said, there's a lot of nuance underneath that. And I think nuance is really challenging for people in this social media age we've gotten into, where you can just post 140 or 280 characters now and make a stance and stand by it. And I think that people aren't incentivized to really dig into issues and find the complexity, like you're saying about meat. Like meat itself has a spectrum. Some of it's really bad, some of it's really good. Same thing with plants. I mean, I think that anything grown on a commercial scale in plants is also bad, not only for health because it's being processed, but for the environment as well.
Right. And I mean, look at giant monocrop soy, GMO, sprayed with glyphosate, that's using massive tilling, destroying soil, using lots of water resources, allowing the spread of, literally huge amounts of glyphosate, which is known to disturb our microbiome, kill the soil microbiome. I mean, yeah, you're eating soy burgers and it's, quote, plant-based, but is it really a good thing? And what should we be really focusing on? It's not monoculture GMO soy, it's regenerative agriculture, whether you're growing plants or whether you're raising animals.
Yeah, and this is something that I've been thinking a lot recently about, trying to distill a lot of my sort of health advice or things I know about nutrition, and it's come down now to two words, and that's just eat local. And I think if people just did that and knew the farmers that they're getting from, if they chose to be vegan but knew where they're getting their food from, could talk to the farmers, see where their plants are grown, or if they're 100% carnivore, can see where their animals are eating grass or whatever they eat, that's fine. But as long as you do that on all scales, I think that solves almost all problems with all the things. I mean, many of the things in your book that you outlined.
It's true. I mean, that's a great aspiration. I think we should try to eat as local as we can. I love going to my garden and picking a salad and having a little regenerative plants out there, but not always possible. I don't have a massive regenerative farm around here, so I ordered, from I think Montana, wild buffalo, right? So I think sometimes you just got to do that. But I think the more we can aspire to eating local and regenerative, and I sort of introduced the concept of becoming a regenitarian, which is, this idea of how do we eat in a way that regenerates our health and regenerates human health as well as planetary health and environmental health.
Yeah, I think that this is something that many people outside of the sort of core people who are diving into health, what makes us healthy, getting into stuff like regenerative agriculture. I've been curious about this stuff for a long time and learning about it. And I always think the best way to learn is by doing. And so my fiance and I actually bought a farm outside of Austin where we live, about 45 minutes east. And just so I could really see the quality of soil, what's going on, what it takes to improve organic matter in soil. And this soil is just like sand. It's almost like beach sand. After you pull out some roots of either grass or weeds or anything, it's just like there's clearly nothing in it. I grew up in Minnesota where there classically is like very, very rich soil, all in the Midwest. That's where all the row crops are. Mm-hmm. And looking now like the importance and how hard it actually is to start bringing animals back on the land to improve the organic matter. This is a really challenging thing. And I don't think a lot of people understand it. It's sort of like the way I think about it is reflective of our health as a country. So you can go to an airport or the post office or whatever and get a collection of people and look around and say, there's a lot of people who are very, very unhealthy. What I don't think a lot of people do is look down at their feet and what they're walking on, because most people live in cities, and go, wow, this is not what a normal ecosystem should look like. This is like this sandy soil devoid of any life is not sustainable. We need life in our soil to provide us with life. This is sort of a cyclical thing. And this is where I think, lab grown meat, things like that, where people think we can just magically harness and pull nutrition out of thin air to make things that are nutritious is a fool's errand. This cyclical thing I think is really hard to get a grasp on. But I think that's sort of the next step about being able to tie all of these challenges together and provide a unified fix.
100%. I think we need to think holistically. We need to think systems. We need to think the overall, ecosystem that we're dealing with of humans, animals, planet, social systems, all of it.
Right. All right, Doc. Well, I know you're a busy guy, so I don't want to keep you too long here. I've mentioned your book about 15 times in my newsletter so far, so I think people are familiar with it. But if you want to send them anywhere else, any other work, let them know where to go.
Yeah, I think they can join my podcast, The Doctor's Pharmacy, every week, which provides a lot of information that goes deep into these issues. You can check out my website, drhyman.com. I have something called Mark's Picks, where I pick my favorite things every week and share them in various categories around health. And you can always sign up for Instagram and social media at Dr. Mark Hyman. That's Dr. Mark Hyman. And follow me.
All right. Thanks, Doc. Thanks for listening to this episode of the Natural State Podcast. I hope you enjoyed it. And if you did, I'd really appreciate you heading over to whatever service you're listening to this podcast on, dropping me a 5-star review and your thoughts on the show. This helps us get discovered by more people and spreading the good gospel of health. And if you want to stay plugged into all of my self-health experiments, recent research and books that I'm reading and my interpretations of those things, products that I'm testing and thoughts on all things related to health, check out my free weekly newsletter called The Feed. You can sign up for that at dranthonygustin.com/thefeed. That's dranthonygustin.com/thefeed. Thanks again for tuning in your support of the Natural State Podcast.